Very good evening to everyone. I am Dr. Anand Katti, Associate Professor at Government Ayurveda Medical College, Bengaluru, located at the heart of Bengaluru city. Today, we are having an interaction session with the two people who are extremely serving the cause of COVID-19. And this interview will be conducted on behalf of Unnati Healing Foundation. Unnati Healing Foundation is a voluntary non-profit organization working for social upliftment, and it is working since almost 25 years and more. And it is working for the vulnerable section of the society and to bring them to the mainstream society with the three causes, that is social inclusion and empowerment, civil leadership governance and social accountability, social determinants of disaster risk reduction. So on the occasion, or rather in the changed situation of this COVID-19, various series of interaction are being conducted, and this is titled as wellness sessions for the COVID warriors. And today in that series, we have a session titled the role of AYUSH in COVID-19 pandemic. So on behalf of the foundation, on my personal behalf, I welcome Dr. Ahalya Sharma Madam to this interview. Dr. Ahalya Sharma Madam is the principal of the Government Ayurveda Medical College, Bengaluru. She is a well-known person in the field of Ayurveda throughout the India, and she is heading a COVID care center also at the Government Ayurveda Medical College, Bengaluru. I extend a very cordial welcome to you, madam. Welcome to this interview session. Secondly, shouldering her responsibility to take care of this COVID care center at Government Ayurveda Medical College, Bengaluru, we have Dr. Srinivas Masalekar, who is Associate Professor in the Department of Shalyatantra at Government Ayurveda Medical College, Bengaluru. I extend a very cordial welcome to you also, sir. Now, since all of you, both of you are extremely working in the field of COVID-19, from the moment the COVID-19 broke up in this country, I want to ask the first question. The first question happens to be, what really were the challenges that you faced as a in-charge doctor of this COVID care center? Dr. Ahalya Madam can come up in the beginning, thereafter Dr. Srinivas Masalekar can come up. So what were the challenges that you faced in the initial stages of your duties as in-charge doctor of this COVID-19, madam?
Yeah. Before I come up with the answer, Dr. Katti, I must thank Unnati Healing Foundation for all the good work they have done since March of this year. Ever since COVID broke out, the pandemic broke out, the panic was very high. And Dr. Saraswati Hegde and all her friends, her colleagues at the Unnati Foundation, without any monetary benefit, with absolute social good in mind, as Charaka says, Natmartam, Napi Kamartam, Atha Bhutadayam Prati. Every evening they offered pranic healing, which was a very, very reassuring feeling to lakhs of people in the state. Many people have benefited out of it. In fact, I have also attended a couple of sessions and I've benefited personally. I have recommended it to a lot of my friends, patients and family. So I must congratulate them for the good work they are doing. The challenges that we faced were, if I may start from the time we had the COVID center proper, there were two major challenges we faced. The first one was the infrastructure challenge, and the second one was the human resource challenge. The infrastructure challenge was, ours is a very typical Ayurveda center, hospital, and we have all facilities for an Ayurveda setup. But handling an emergency was difficult. Also, we had to make sure that there were no repairs or anything else that had to be done, because it would all be a contaminated zone and nobody could go inside even to replace a bulb. So we had to make sure that every infrastructure in the college, whether it was a geyser, whether it was a solar, whether it was the sanitary lines, everything was working. And a government setup, there are loopholes here and there, which, I mean, it happens in our own homes. Why talk about a government center that there is a tap which is not fixed? But we had to make sure, and I must remember all my colleagues. I praise all my colleagues. I place on record that each one stood up and each one took care of a ward, making sure no cot was broken, no bed was torn, no pillow was not done. So everything we made sure was done. And I must again place on record the beautiful work BBMP did by supplying every little thing that we asked. It took us about 6 full days of hard work to make sure that the center could take off, right from bringing in oxygen and every other facility that was required. We could imagine the tension. See, now it is almost 2 months since it all happened, and we are kind of used to it. We have heard so many corona cases, COVID stories that have come up. So we now know, okay, this is what it is. It's okay. It's not that deadly. But when we started way back in June end, then it was still quite new and we didn't know what it would be. We were worried about the contamination. People were scared. So this was about the infrastructure, where we were here and we had to go up 2 notches in a very limited time. And our commissioner, our entire department stood up with us and helped us, go peak those 2 levels and establish everything. And by God's grace, today people are very happy. So happy that they say it felt like coming to a picnic. We have feedbacks which say it was that good. So all my colleagues who chipped in with me and did. This was the first challenge. And the second and the more important challenge was, we are AYUSH doctors. We have worked in a different tangent. An emergency like this, a PPE kit, was a little new to most of us. Though I must again tell you, all my colleagues, my entire department had worked in the home quarantine services, in the BPMP surveillance unit, in telemedicine, yet it was of a different kind. Now here there were mild and asymptomatic COVID patients, so they had to get in with the PPE. And the senior they became, the fear was a little more. The youngsters were better. So the more senior we were, and some of us genuinely had health issues. One was asthmatic, another was a diabetic. So whom would I take? Whom would I not take? That was a greater challenge. But once the first set went and said, no, it's okay, it's not very bad, people can manage, then it so happened people started coming and asking, ma'am, I would like to go in. So much so our youngsters, our interns come today and say, ma'am, please put me in. I want to work. I want to work. Now the fear is gone, and accept a sense of service and dedication. It's like, I want to take up this challenge. And no, many a times people think when we, there is a dilemma here. When we say government and free, people think it's not up to the mark. And when private people say, they say, you fleece us. So where should actually medical fraternity go? I want people to recognize there are this set of committed individuals who are here to serve you. Every profession can have one person who does not fit in completely. So for one mistake somebody has done, knowingly or unknowingly, kindly don't put the fraternity there. Doctors are today the most stressed individuals, the most infected individuals. Their families have been, they have compromised for months together. I have my colleagues who have small little babies and they say, ma'am, I haven't carried my child in 4 months, in 3 months, because they are scared where they would be taking home the infection. So they have in fact stayed away from families for a long time. These are sacrifices. They're as good as warriors on the battlefield who stand on the Himalayan mountains or guarding our boundaries. Our people have done similar work. They have put on the PPE, they have gone. In fact, every patient who comes there, for him, it is a new experience. To me, it may be my 1000th patient, but every patient, it is new. And they have been sensitive enough to make sure that they give the same kind of care. They have reassured each patient. Another thing I must mention, being the AYUSH facility, yoga was introduced in our center. Pranayama, breathing exercises, yoga, counseling, all this has been a part of our setup. As and when it depended on the expertise of the doctor who was working. So whenever possible, we have made sure that we have thrust all these ideas and people were reassured. So this was the challenge from in starting the hospital. Maybe
Thank you.
Srinivas would share more with us
Thank you,
now.
madam, for throwing a light on so many aspects of the challenges and the way you handled it. Of course, I love to listen Dr. Srinivas Masayakar sir also on the same issue. Srinivas sir, if you can throw light, particularly because you were instrumental in shouldering the responsibility of Ahalla madam in setting the COVID care center. So if you can throw light on what were the challenges that you faced in the initial phase of setting that COVID care center. Now we know that it is running pretty much smoothly, but certainly there were tough time in the beginning. So if you can throw some light on that, it will be nice, sir.
Thank you, Katti sir, and thank you, Hala madam, for giving me this opportunity. And also, I would like to extend my warm thanks to Unnati Healing Foundation for giving me this opportunity to speak on the COVID care center, which is run as number uno in the COVID care centers of all Bangalore and etc. So now the GAMC COVID care center is regarded as one of the best managed COVID care centers. So initially, when the COVID care center concept was it was introduced, it was very much new to all of us. We don't know where to begin from. Then we have completely modified our running Ayurveda hospital into an entirely a COVID care center, which was a very difficult task then. Then with the inputs of principal madam, commissioner madam and everyone, we have started working on each and every single aspect, starting from accommodating patients, accommodating the medical fraternity and accommodating. Initially the hospital which runs smoothly, wherein everybody goes in and come back on daily basis, on hourly or even on minute basis. But in case of COVID care center, where you admit COVID patients, COVID suspects, or even the COVID positive patients who are asymptomatic actually in our COVID care center, but the doctors who will go inside, they will wear up a PPE kit and they will treat those patients. So a normal individual is not allowed to go inside the hospital. That was the major challenge. So you need to supply them food, starting from food. You need to supply them medical supplies. You need to supply them oxygen. You need to supply them water. Every single thing need to be supplied on a daily basis, right? This was the one major challenge which was ahead of us. Like we have tried to manage it quite comfortably with the help of all the advices given by principal ma'am and everyone. So we have divided our hospital into 3 areas, where in one area, in one door, all the supplies will go inside. From another door, all the patients will get into the hospital, and from the other place where all the medical fraternity will go in, so they will wear PPE kit, which is called as donning, and then they will go into the duty and they'll come back to the same area. So this is how we have tried and managed everything. So once the COVID patients are inside the hospital, the entire premises becomes a contaminated zone. Okay, so it was a very big challenge to supply the necessities inside the hospital, so which we have tried to manage it over a period of time. So now, as we have sent in the 6th batch of doctors inside yesterday, now from the beginning to today's scenario, it's entirely changed. The challenges were greater in the earlier. Now all the challenges we could able to nullify, and now we are able to do the needful at every demand.
Okay, very nice, sir. Great job done. Again, congratulations on my personal behalf also. Now, since you made a mention that it is the 6th batch that has entered now, if I can get from any of you, can you throw some light on the statistics aspect of our COVID care center as regards to the number of patients that have entered into the COVID care center?
Sir, now as on now, today, initially when we started, the government orders were issued for 200 patients. Then the officials came and they have increased the number to 260. For initial 1 month of time, we have admitted 260 patients on a daily basis. So since till the beds are filled, and last 15 days again the bed strength is reduced to 200 only. So as on now, as on today, So there are more than 1,600, 500 patients were admitted into the hospital, and rarely around 8 to 10 patients are referred to higher center for some complications which were arised. Otherwise, so as on now, there are around 180 inpatients. So everybody else are discharged and they are went back home safely and happily.
Fine.
And after getting negative corona result.
Very nice, sir. So, if I can ask our beloved Madam, Hala Madam, Madam, we have heard that the Ayurveda medicine is it has become internationally known, or rather gained much popularity in this COVID period. So I'm sure you're taking care of this COVID care center also, but at the same time, the common public also wants some advices from some medicines that need to be given. So if you can throw some light on what the Ayurveda can contribute, what the Ayurveda medicine can contribute to the common people, or rather on the platforms like Immunity, etc. So it will be nice for the viewers. Can you come in, madam?
Sure. Dr. Katti, yes, I would. Every opportunity comes with a challenge. I mean, every challenge, every pandemic or anything that we face comes with both a challenge and an opportunity. And this has done both to Ayurveda. We have a lot of opportunities that have opened up. In fact, our students got the online classes, webinars were done. People across the globe connected. We could easily connect to an alumni who was doing extremely well as a practitioner. We brought them up as for guest lectures, and I think we had more than 150 guest lectures put together for our students. So those were one set of opportunities where people learned to be more digitally savvy. The second part, and the most important part, is we have the AYUSH Mantralaya, which has given us beautiful guidelines as to the treatment protocol, the diet that has to be followed, etc. But somehow some regulations pending, the implementation is seeing a bit of a problem. The world is pushing towards integrative medicine. All the systems of medicine have their own limitation beyond a point. Now, COVID, as Dr. Srinivas mentioned, most of them we see as asymptomatic to mild. And there are some moderate and very few which get into the actual complications where they need ICU. This is in the infected group. But the non-infected group, which is the larger population, the fear is so much more. Will I get it? I went out, can I get it? You can't stop life for months together. You have to go buy your groceries, you have to buy your vegetables, you have to go back to work. How do we handle that? Kind of the panic is one which most of us have been able to handle, and it falls very well within the limits, the scope of Ayurveda, swasthasya swasthya rakshanam. So we have all done that part completely, that we have been able to allay fears of people who came to us. How did we do it? We did it in 3 ways. Again, the 3 ways are not what we designed, but what our Shastra says: Sattva Vajaya, Yukti Vyapashraya, and Daiva Vyapashraya. Sattva Vajaya, as we all know, is Ahitebhyo, Arthebhyo, Manonigraha. So we told them, whatever is not okay, please keep that away. Do not get into it. Like, you can't blame the media for showing whatever is happening. Whether they blow it up, whether it is real or not, is up to them. We do not know. I'm not here to make a fact finding. But we know it is disturbing you, then keep away. There is nothing which prevents you. Get your basic details of how many people have been infected. The rest of it, please switch it off. Don't get into it. And then we had to tell people to, the Sattvic people can somehow manage. That's how the classics tell us. There are some people who say, okay, it has happened. We have to go through. What can we do? And there are some when we say, okay, don't be scared. I'm also going through the same. So they get reassured. And there are some where it is very difficult. So we did the psychological part and we did the medicine part. Initially, much before all this happened, on the 22nd of March, if all of us remember, in our college, we had the first meeting and we designed the medicine for it, the antivirals that were available with us. And we packed it up and started distributing it to people as medicines which were antiviral basically, and which could build up our immunity. Well, this disease, we know two people have been living together, they have sat together in the same cubicle. One is affected, the other is not affected. And why did the person who was affected, he doesn't even know where he could be infected. But the person who was next to the person was not affected. All these we have been hearing, and that we know today is because of the Vyadi Bala Virodhitvam, as Ayurveda says, their capacity to hinder the progression of the virus in their own body. So improving the immunity is what the entire world has been saying, and the best way to do it would be through the natural means, because it's very close to the body, so we know it works there. It is not just about giving some medicines and improving it. It is about taking care of their appetite, making sure their lifestyle is good, making sure they eat right. This is where we all falter. Knowing everything, I still have the meal at 9:45 and I sleep at 10. Or I have my meal at 10 and sleep at 1:30 or 2 in the night, all of which is wrong. We know about Bhuta Datri, the sleep from 10 to 4, which must be, that is the time when the body repairs itself. So all these advices, in fact, this has been actually a good way for people to fall back to the right routine and right lifestyle. Apart from that, I must mention of the tablet, the classical tablet of Samshamani Vati, which contains Tenospora cardifolia, Guduchi, which we have distributed to more than 15,000 people as of now. We have given it to people, explaining how it works, along with Arkeajib and a couple of other, the Kwatachurna mentioned by the ministry, which is prepared by our own department. And the department has facilitated us to, has given us the medicines. We bought the medicines extra, and many of the medicines we have used it, and we have distributed it to people, to schools, most importantly to the Paura Karmikas and the police personnel. They were the ones who benefited the most in what we did, and we have done that along with this kind of education. So we have done health education, health service, both of it has gone on, because only dispensing the medicine is not enough. It is like giving them fish, but then we have taught them how to fish as well. So we have instilled these habits, and social media is full of this today. Television is full of this. People are aware, so they want it. Along with this, I must add here that we realize what is really important in life, what is our need, and where our greed and want was. So I think it is a time for us to segregate both, have healthy relationships, good people to talk to, lighten our burden with so many things, live healthy, leave the rest to God, smile and say thank you to Him.
Very well said, madam. Indeed, putting the theoretical aspects of Ayurveda into practice is indeed the need of the hour. And through the three dimensions of our chikitsa in the form of Sattvavachaya, Dayavapashaya, and Sattvavachaya Chikitsa, you have done it. You have demonstrated it through the actions by serving the people who are really vulnerable, because those Paura Karmikas, those police officers, those are more prone to get infected. And I have to say thank you and congratulations on behalf of everyone. Srinivas Masalekar, sir, if I can extend the very same question, I know you are also very good practitioner of Shalya Tantra in the city of Bangalore. Can you give any which were your favorite medicines or tips, rasayana dravyas that you prescribe particularly for those COVID patients or those who are vulnerable patients?
If you ask a practitioner like me to talk about the drugs what we use, like one of the major aims of Ayurveda is swastasya swastarakshanam and aturasya vikara prashamanam cha. Okay, so aturasya vikara prashamanam cha is like treating the disease comes later, whereas swastasya swastarakshanam is the protection of, or the swastha, or the in protection of swastha in a healthy person becomes a very important issue initially. Okay, so we should always try to build the immunity of any person. So in my general practice, as a routine, we use Chavanprash, one of the medicines which is told by central AYUSH government ministry. So that one we are using, and then Ashwagandha Churna we are using, and also if at all the patients are having any of the symptoms like cough and then cold, etc., then we use classical preparations like Talisadi Churna and then Sitopaladi Churna, along with that St. Madhu Churna. So all the combination of these churnas we put together and we make up a kashaya, and also even the powder is also taken along with honey, so that the people will get relief from the acute conditions. So that one we are using, and also we have been using we have been advising the patients to consume the various kashayas which are made up of trikatu, and then Haridra Churna, and then Ashwagandha. So mixing all these together and preparing a kashaya and taking it daily. So apart from this, we need to advise the patient to regularly follow Dinacharya and Rutucharya, as Madam rightly pointed it out. So Sattvavajaya, Daiva Vapashraya, Chikitsa, everything all together. So initially, because to protect the swastha of a healthy person or the health of a healthy person, one has to follow regularly the Dinacharya and Rutucharya, which are the basic pillars of the Ayurveda, okay, and one's healthy lifestyle. So if one will follow the Dinacharya and Rutucharya, so he will be very much healthy, and also he needs to understand his own body. Okay, it has been popularly said that the Dhairya Atmadi Vijnanam. So Atmadi Vijnanam is the self-analysis. So one will know very good about himself. So how much if at all he eats, then he will be happy, or how much if at all he walks or he exercises, which will be enough for him. Nobody than anybody else coming and telling him like you eat this much or you eat that much, you exercise this much. It is oneself who has to assess his body and do it accordingly, will help the person to protect his health. So along with that, Rutucharya, Dinacharya, and all the other medications what we have just told now would definitely help.
Thank you very much, sir, again for the detailed reply. Now, if I can ask you, because for the benefit of the viewers, are there any COVID-19 cases seen in the teaching community of Government Ayurveda Medical College, madam?
By God's grace, we have not had anybody who has suffered. All of us, since March, have been taking the medicines, some on and off, and some have been taking it regularly. And we had one doctor who was working inside the hospital. Unfortunately, he was a young person in the 40s, but a diabetic, and he did test positive, but thankfully he did not become symptomatic. He was asymptomatic positive, and he is now free of it. So no doctor who either worked inside the COVID care center, or as of now, nobody who was out in the college, nobody has tested, though some of our office staff who use public transport have tested positive, and thankfully they were all admitted in our own center and they have recovered well.
That's also very good news. That itself speaks that those who are caring will take care of themselves also.
Yes.
Now, since we talked about many questions related to the administrative aspect, but I show as a human also, I am sure you will also be going through different stresses, emotions, tensions. So my next question would be, how did you protect yourself during this COVID situation, madam?
My first bout of cough and fever actually started on 28th of March. That was when lockdown had started, but we were coming to college, and I don't know if I was exposed or whatever. I knew I was not well. I had some mild symptoms, maybe just a viral flu because of the weather change. We didn't test anyway. So that was one time that as I said, that is when I met Unnati and asked them to, because I realized the medicines I was taking, I was on the usual Sudarshana Ganavati, Khada, etc. But I wanted a different perspective. And being a doctor, I couldn't tell anybody that I'm also scared, or I needed that. So I shared it with them, and they did the pranic healing, which really helped me. And once I got better, then I started doing it, telling people, and then I could counsel many more people to that. So I needed that extra one. Then that was my first one. And when we were seeing patients in the month of May, towards the end of May, we started our OPD, and I was seeing patients. And those days, once in a way, when I met a patient from a close distance and then they had cough or something, I would wonder what's happening. Will they get it? But then I would tell myself, see, we have taken all these medicines, so we must be rest assured. So there's no point getting it. Now it's become a common thing. So you're no more worried about it. Also, we have been, as Dr. Srinivas pointed out, Ashwagandha, Javanaprasha, Samshamanavati. These have been on a regular basis to us. So most of us are using it, and we have distributed it to all our staff also. It's going on.
That's indeed a great going, madam. And indeed, it was very nice talking to you, both of you. It was almost a half an hour interview that we did.
Oh my God.
On behalf of Unnati Foundation and on my personal behalf, extend a very cordial congratulations. Hope you continue to serve the humanity, and hope that the mankind comes out of this crisis of COVID-19 at the earliest.
Yes.
I thank both of you for your time and valuable suggestions, and see you next time. Thank you.
Yeah, Dr. Katti, I had never felt the importance of the shloka Sarve Bhavantu Sukhinaha. Unless my neighbors are healthy, my chance of anyone being healthy is less. So Sarve Bhavantu Sukhinaha, Sarve Santu Niramayaha, Sarve Bhadrani Pashyantu. Meaning of the word Bhadra, and as we say in Ashtangradaya, Bhadra Magamashalinam Abhyastah Karmanam Bhadram Bhadram Bhadramashali.
Yeah.
So unless everybody is happy and healthy, you cannot be healthy. So this brings in the importance of community and what it means to live together as a community and to be healthy. So we are all connected universally, whether we realize it or not. In the small pockets we make, it's time to break that, come out and feel the oneness with everybody, pray for each other and keep each other safe in whatever way we can, help each other as much as possible. Thank you for this interview. Thank you, Unnati, Srinivas. And
thank you,
I must mention Dr. Shivaprasad and Trupti, who have also been with us all through our journey here. So thanks to everybody. Katti, thank you.
Thank you, sir.
Thank you, both of you. Okay, thank you again.